The name tag does help keep me away, right?
Yeah, it does. You wrote that article, Damn It, Jim, I'm a Doctor?
Damn it, Jim, I'm a doctor. That's the article I wrote.
Very good, I like it. So you actually do direct patient care, right?
I do.
So then you actually know the feeling. You know the feelings, you know the level of frustration, you know the stress, and sometimes even the rage of using existing EHRs, don't you?
Good God, yes.
You know, they're antiquated, they're slow, they're convoluted, and they're not very user-friendly.
Yeah.
They actually dramatically slow down our ability to care for patients as well. You know, bedside care is just getting more complex every day, and the pace is just getting faster and faster. And what's most maddening about the whole thing is that the tools that we have right now are not adequate to the task at hand. The information they provide is a very limited view of what's actually happening with a patient at any given moment.
Yeah.
A picture, though, a picture is worth 1,000 words.
I agree.
What I'm doing is I'm redesigning EHRs, designing novel user interfaces that allow rapid data entry. You know, so imagine an ongoing and ever-changing, evolving, interactive 3D holistic model of your patient, replacing two-dimensional pages of checkbox after checkbox, and actually creating and using multi-dimensional interactive data fields and panels that allow the user to look at multiple aspects of information simultaneously to create a global overview of what's actually happening with the patient. It's basically painting a picture of the patient's condition at any given moment in time. So all the relevant data is only a tap, a swipe, a gesture away. You know, it's kind of like a video game for healthcare, and I think that's the way the future is going to go. So what I'm doing,
that sounds great. Yeah, you got me. It's interesting. I'm writing another article around that, so that's great.
Very good.
I'm hooked.
So what I'm doing right now is I'm in the early development phases where I actually draw out what screens would look like, schematic drawings, storyboards on how workflows would progress. So items that would sometimes take 20 or more clicks of a mouse are reduced to 5 single touches, everything very visual, very streamlined. So what I'm looking for is people in tech that might be interested in helping build this.
Yeah. You know, I think that, I actually know a number of people. Are you looking for like designers or artists or programmers, or what are you looking for?
I think logistically at this time, I think it's an innovative idea that is going to be before its time. But time is on my side, because what we think we can achieve in 2 years is usually overestimated, and what we can achieve in 10 is underestimated. If we could build it tomorrow, it would never be accepted because it's just too different.
Right.
So time's on my side. So right now I would look at people that could help develop almost an animation of what it would look like, so that you can enthrall people with it enough and gain support, so then you can bring the programmers in and start doing the really nitty-gritty nuts and bolts of it.
Totally. Yeah, no, I love that idea. Create the vision first, and then get the kind of excitement behind it. So one of the things that, so I'm a huge fan of that, by the way, because I've had that very similar idea for some time, and I think that you're right. The text-based information is not the way to get in all that information.
It's one-dimensional, and then every single user, be it the doctor, the nurse, the dietitian, PT, OT, everybody only has this splintered, sort of fractured picture of only what they're dealing with, rather than a team working on the same global picture of the patient, where every aspect of them is basically apparent. As soon as you do something to the patient, you see it, you know it. You see the triple lumen, you see the BKA, you see the ostomy appliance. All you need to do is touch on it. It gives you all the relevant information. Otherwise, right now, what you do is you dig through layers and layers of just numbers and words, and then it's left up to the individual to paint their own fractured picture of the situation.
Yeah. So, where are you in this? Where are you in the process of doing this? You said.
Well, as I said, so basically the same way any kind of video game, movie, or commercial is started. You do storyboards, you do drawings, you show what it would look like. You work out pathways so that when you approach somebody to do either imaging or developing of it, you have to be able to answer every question. Okay, so you do this, and then what? And then you do this, and then what? And you have to have an answer for every then what,
Right.
for a process or a procedure.
Yeah.
It's very visually oriented, and I'm saying input device agnostic, because every level of care is different and has its own special, unique stress points, where some areas are slower, but you have higher volume, others are less volume, single patient, but much more data involved.
So what's the biggest, what do you think the biggest obstacle for you facing, your challenges right now?
Acceptance.
Fair.
Because I use the term because there's no other terms available. I say
So,
that it is game life.
One of the big things, and I actually firmly believe in what you're doing. I think it's a great idea. I think that one of the biggest problems we're having, and it's one of the big buzzwords now, is like interoperability, and like how do we get all these systems to talk to each other. So what do you think about how you're addressing that problem?
Interoperability, yes. So I would say this. If you had a house,
So our elevator just crashed through.
I think it actually stalled. I think it stalled. We might be stuck here for a few
I'm gonna get on there's the emergency button. Hello? Stuck in the elevator. Okay, they pried us open. So, hey, it was a pleasure.
Yes.
Thank you. It was a great idea. Yeah.
Thank you, Mark. Any questions? Any questions for Mark?
Mark, yeah, come back up.
Any questions? Otherwise?
There, right there.
Sorry.
So if I use your EHR and then I transfer to another hospital or another network and I need it translated into Epic or some other EHR record, how will you do that?
When is this you're talking about?
I'm sorry?
When is this you're talking about?
Well, assuming that you prototype the product, it's viable.
Let's get back to your question. So if I had an old house, and this house had to be renovated, and it had a bad foundation from the beginning, would I rebuild on that same foundation? And that's the problem I see happening right now, is that our foundation is flawed from the beginning. So what do? You just stay with this all the systems that exist right now are built with the same building blocks. They're built with Windows-based spreadsheets, because it's all billing based. So what I'm suggesting is moving into something that's more pictorial based. So interoperability, you go to me, we give you care. In our facility, you go to another facility. I make sure that you have a read-only documentation that you can provide to them, that they can either scan into their system or they can plug it in as a visual file, as I said, and read-only, where you would have this pictorial history that you could simply dial through time. And as time passed, it's like, oh, now I see that there's a Foley, okay, because that was put in on that date. Oh my goodness, and then all of a sudden there's an ET tube because they were intubated on day 4, and now there's an EVD drain because they had a stroke. And you would be able to see this tracking over time. So right now, to try to play the game of I want to be the universal translator for every system that's out there, I think is a hard task for anyone. So instead, make your own universal system that you can just transfer to other people.
Great. Thank you, Mark. And I just want to acknowledge this was Mark helped design